Greetings from Austin, Texas. I am Ruth Wasem, professor at the Lyndon B. Johnson School of Public Affairs here at the University of Texas in Austin. This year, the LBJ school turns 50. Throughout this landmark year, we celebrate the LBJ school's half-century of impact, not just within the walls of the academia, but within the arena, in the arena. And our new live virtual series is LBJ in the Arena, bringing together world-renowned policy experts and frontline stakeholders to serve and inform during this unprecedented global crisis. Today, I have the pleasure of being joined by Eric Schwartz, the president of Refugees International. Eric has a 3-decade career focused on humanitarian and human rights issues. He served as U.S. Assistant Secretary of State for Population, Refugee, and Migration from 2009 to 2011, and is credited with strengthening the State Department's humanitarian advocacy around the world. He was also a human rights and humanitarian official at the National Security Council during the Clinton administration, and responded to humanitarian crises at that time in Asia, Africa, the Middle East, Europe, and around the world. Eric, thank you for joining us today. By the way, we will be taking questions at the end of the session using chat. So if you have a question for Eric or myself, just put it in the chat and we'll get to it during that period. I'm going to be beginning with a brief presentation on the refugee crisis as it stands now. So, where did my... I hope you can all see the screen. A little bit of technical pause here. So let's begin by getting a clarity on the definition of who exactly is a refugee. These are defined in statute and in international law and in US domestic law. So let's begin with what a refugee is. And there are 2 parts. It's establishing that you have a well-founded fear of persecution, and then that persecution is based on one of 5 characteristics: your race, your religion, your nationality, your membership in a particular social group, or your political opinion. That's the broad definition that's accepted internationally. In the United States, we did not, even though we signed on to the refugee protocols under the administration of Lyndon Baines Johnson, we did not incorporate that into our law until the Refugee Act of 1980. That's when we added the international definition, which of course had grown out of World War II and the Cold War. What the Refugee Act of 1980 did, among other things, was that it established that refugee admissions to the United States, this is where we become a 3rd country of resettlement. So people are displaced abroad, they meet the definition, and then we as a nation, and this is something of course that Eric was heavily involved in, we decide which refugees are of special humanitarian concern to the United States and that are not firmly resettled in another country. That's one of the core principles of the Refugee Act. Another key thing I want to bring up about the Refugee Act of 1980 was that it set up in US policy a separate track for what we call asylum seekers. And this is distinctive about US policy in that we differentiate refugees who are displaced abroad from people who arrive at our ports of entry or who are already in the United States and they request an asylum. An example could be a foreign student there's a coup in their home country, their parents have been arrested, they can't go home. They would apply for refugee status. Or someone who's already in the United States. And then the big issue that we've been facing the last, for many years, but it's particularly pressing here in Texas in the last few years, are asylum seekers at our borders seeking asylum in the United States. That distinction was put in again in the Refugee Act of 1980. Now, not everybody meets the definition of the refugee. As you just heard, it's a fairly narrow definition. About 1/3 of the 70+ million forcibly displaced migrants are considered refugees. So I'll briefly describe some of the other types of forcibly displaced people who are of humanitarian concern, but they don't meet the definition of the refugee. One group, of course, are the internally displaced, because the concept of the refugee is that you've had to flee your country. Many people are forced to migrate, but they're still within their country. And so this is a growing concern, and there's over 40 million internally displaced people now. And so that's quite a challenge for the global community. There are people that don't meet the definition of refugee, even though they have very compelling stories and great fear, because the courts and policymakers have viewed people fleeing such things as gang violence or domestic violence or just general civil unrest in their country that's not political in nature, or that doesn't take on one of the 5 attributes of the refugee definition. So they might be fleeing violence, but they don't meet that individualized persecution. This, again, is one of the thorny areas of what does it mean to be a refugee. And again, it's something that the Central Americans seeking entry to the United States have been dealing with for many years. One of the other areas of vulnerable populations that are of growing concern are people being displaced by climate change. And typically, people displaced by climate change are usually internally displaced within their own country, but it is not uncommon for them to be forced to force borders. And so this, again, is a growing concern. Finally, a population I am particularly concerned about are stateless people. And there's almost anywhere from almost 4 million to 10 million people that can't claim a citizenship in any state, whether it's difficulties in registering births in countries, or more commonly now, women who give birth in countries that don't recognize births to foreign nationals as citizens, and the inability to be able to establish what country you're a citizen of. So this is a growing humanitarian concern, again, not a refugee. Now, I'd like to next turn to the scope of the crisis. What is the magnitude? And the UN High Commissioner for Refugees put together this infographic at the end of 2018 data. And I'm using 2018 data through much of this presentation. Is that kind of gives you a sense of the scale of people that are displaced, people that are refugees, people that are asylum seekers, and what the source countries are. As you can see, it's a huge issue. And the top host countries are Turkey and Pakistan, Uganda, Sudan, and Germany. And you can see that the top source countries are Syria, Afghanistan, and South Sudan. And we'll be talking a little bit more about this, but most refugees, about 80%, live in countries that are adjacent to the country that they're fleeing, according to the UN High Commissioner for Refugees. That's a significant issue, and it just brings to bear the pressures that are placed on neighboring nations in these times of crises. So as I alluded to, mentioned actually, the top source country right now is Syria, and Turkey is hosting most of them. The United States, as of the last numbers I had, has received just over 21,000 Syrian refugees since 2015, out of the millions of Syrians who are refugees. Some of the refugees span generations, and the Afghan give you the sense of that. And we know how long the conflict in Afghanistan has been wearing on. Pakistan hosts about 1.4 million, and this includes second and third generation refugees. The United States, since 2016, has brought in about 5,200 Afghan refugees. In Africa, the largest group of refugees are South Sudanese refugees, and about 1.8 million are internally displaced in South Sudan. Most, 63%, are under the age of 18. So we're talking about vulnerable populations. In our hemisphere, in the Western Hemisphere, Venezuela is the largest group of refugees. I have in this chart over 4 million. I think it's safe to say that number is probably pretty close to 5 million now. Most of them are in Colombia, but the United States has been receiving Venezuelans. Several hundred thousand are here, and I'll give you a little more statistics on that in a brief moment. So that's the scope of the crisis. Now, what is our administration? What are the Trump policies on this? And I think it's safe to say that President Trump has led a U.S. retreat in global leadership on refugees and humanitarian issues. It's part of his America First agenda. And for example, just in the resettlement of refugees, which I've mentioned we've been doing since the 1980 Refugee Act, we, under President Trump, have set the levels at the lowest levels since that act was passed. And as of 2018, we are now behind Canada in terms of the numbers of refugees that we are admitting. So you can see from this graph that the Pew Research Center produced that our long history of generous refugee resettlement is no longer the case. And finally, a brief word on asylum seekers. As those of us living in Texas know, there's considerable pressure on our southern border with asylum seekers. So I wanted to share the latest in that. And so here's the spread of over 20 years of asylum data. And in recent years, we have hit the levels that the United States had hit in the 1990s, in the mid-90s, when we also had large numbers of asylum seekers. We have had in recent years a slight uptick in approvals of people gaining asylum. And this is largely asylum seekers from the People's Republic of China, which has always been one of our top countries getting approved for asylum. And more recently, people from Venezuela are now ranking #2 in terms of grants of asylum. So that kind of tees up the discussion of where we are in refugees, and a brief word now as we collide with the global pandemic. 2 points I want to make before I turn to our distinguished guest today. One is that refugees are frequently in highly congested areas in their host countries, and they often have very limited access to healthcare. And secondly, I was just checking the news feeds in the last few days, and there are new reports of COVID in some of the refugee camps. And there are many refugee camps around the world, and that has been a great concern if COVID were to enter the camps. So I am going to end this screen share, and with great pleasure, turn to my friend, Eric Schwartz, because Eric and I actually, before his distinguished career, we both started on the Hill at about the same time, and he worked for the House Foreign Relations Committee. And I'll begin because of of what he knows is so much about this nexus is how is COVID-19 posing problems that are particularly unique for refugees? And do they differ whether they're in camps or whether they're dispersed in the host countries?
I guess I should unmute myself first before I respond to your question. It's a real pleasure to be here, and I want to thank the LBJ School and you all. And it's always a pleasure to be even virtually connected to any institution that Angela Evans is connected with. So it's thank you so much for this opportunity. Why don't we start? Well, first of all, of the world's more than 70 million forcibly displaced people, some 26 million refugees, and more than 40 million what Richard Holbrooke used to call internal refugees, which is a contradiction in terms, but internally displaced people. Of the bulk, the majority of both refugees and internally displaced people don't live in refugee camps. They're outside of camps. And I think that's a very important fact to keep in mind when we think about issues surrounding the global response. But there are commonalities. We should start by remembering that the particular challenges that refugees and other forcibly displaced persons confront in this COVID-19 emergency are unusual and significant and substantial. First and most importantly, this is a crisis that has impacted everybody. So countries are distracted, so donors, government donors are distracted, because we're all focusing on needs very close to home, literally and figuratively. And though our common humanity might dictate that we be concerned about all vulnerable people anywhere, that really isn't, tragically, often the first priority for communities in the global north, in a position, who might be in a position to help. And so, and what makes this so challenging is, as to get to Ruth's question, is the particular vulnerabilities that refugees and other forced migrants and confront. Population density, not only in camps, but also in urban areas where displaced people typically live if they're not in camps. Lack of access to health care, lack of access to information, restrictions on the movement of humanitarian aid, and a grossly, to my mind, grossly inadequate international response to humanitarian need in this crisis. Indicative of that, perhaps, is the fact that the United Nations $6.7 billion COVID-19 global humanitarian response plan is maybe funded at about 15%. You know, I could go on, and well, maybe I will go on just for another minute and just say that at this point, another challenge is that 90%, according to a recent Pew report, 90% of the world's population are in countries with restrictions on non-citizens and non-resident arrivals. And about 40% live in countries where borders have been completely closed. So the issue is policy, its capacity, and I think the challenges are significant and substantial.
So I want to pick up a moment on, you know, the 90% of the refugees in countries that restrict access. So this would really play out in terms of their ability to get access to health services if you know, at a time when we would want everyone to be able to get the public health service they would need. Are there differences among, do you know, are any of the countries addressing this concern? Are there some leaders?
Yeah, I mean, it's a great question, and it's very difficult, Ruth, to talk about you know, specific policies. In other words, to try to generalize. But what I will say is, first of all, in some cases, it's not as much a function of policy as it is a function of reality, right? So if you're in Idlib in Syria, and you're one of 3 million displaced persons who have been forced into that part of the country, or are in that country and are displaced, and there really isn't you know, effective government structures. You're in a conflict area. There isn't access to health facilities. So there, in a situation like that, you know, it's the challenges are going to be significant, substantial, you know, really sort of overwhelming. There are, if you're in a country like Colombia, and we're about to issue a report on Venezuelans in Colombia, your situation there is going to be very challenged and compromised for all the reasons you might expect. But you do have a government that has at least articulated policies of inclusion and policies designed to meet the needs of all the people, you know, in the country. And so that gives, you know, some, it's not going to prevent access to critical facilities, but it will create at least some opportunity for non-citizens to have access. So I think policies really vary. I think in camp settings, you're going to have, and we're going to see particular challenges relating to the fact that the areas are so concentrated, the fact that services are not highly developed, that health services are not highly developed. You take, for example, the Rohingya camps in Bangladesh, where there are upwards of an estimated 900,000 Rohingya refugees in the camps in Bangladesh, and measures are being taken to try to create some degree of protection. And the first outbreak of the first positive case of COVID-19 was reported recently over the last couple of few days. And so they're going to face significant and substantial challenges, and issues will arise. For example, if sort of intensive care facilities are not available in the camps, what kind of access will refugees have to the very limited facilities that exist outside of camps? Those are all issues that are coming to the fore, but because the COVID-19 outbreak has been, you know, the worst of it is not expected for the next 3 to 6 months in any of the humanitarian settings, I think a lot of this is yet to come. A lot of these challenges are you know, are still to be addressed.
I wanted to ask you as well about the refugee aid workers, all the people that work in humanitarian service around the world. How are they faring in this environment? And has COVID, you know, it's affected our ability to go places. How has it affected getting aid to refugee camps, and also helping, has it brought the refugee processing? Has it slowed or stopped refugee processing?
Well, as I understand it, UNHCR has suspended refugee resettlement programs in which it's engaged for now, and we obviously hope that this will be resumed as soon as possible, because those who are eligible for resettlement from the way the resettlement program works is, in general, the UN, a refugee in a host country, in a country to which the refugee has fled, seeks to be resettled in a durable way in a third country. That's when people speak of the International Refugee Resettlement Program, that's what they're talking about, as we've mentioned. And in many, if not most cases, those eligible for resettlement are particularly vulnerable and at risk in host countries. So it's important that those programs resume. But on the first part of and we can talk more about that. We can talk more about that when we get into the discussion of the border and asylum, and who should be excluded, and who shouldn't be excluded. And those are all very important questions. And let me say parenthetically that as the former dean of a public policy school, the Humphrey School of Public Affairs, I've sort of watched the policy debate in this regard with some concern, because I mean, if there's a religion at public policy schools, it's the religion of evidence-based policymaking, right? That's the God to which we all, pay deference, and it sort of is what we assume we're doing that we're training people to be policymakers so that they will be able to apply evidence-based analysis to the thorniest of public policy challenges. And it must be quite unsettling to be at a public policy school at this point, when we see how policies are being made both internationally and domestically on these issues, because they're so, it is almost being done in an evidence-free environment. And that's sort of just prelude comments for our conversation about the border. But let me get to your question before the end of the hour. International aid workers are indeed traveling less. Not necessarily, although in part for their own safety, but also as not to be vectors for the disease. For example, South Sudan's first COVID-19 cases were all UN staffers, which led South Sudanese soldiers to surround UN peacekeeping bases. In some places, there are access issues. Burundian officials summarily expelled WHO workers, and several humanitarian organizations have been blocked from providing assistance at quarantine sites. Aid groups are stuck in the capital of Burkina Faso, can't get relief to some 800,000 internally displaced people who are in hard to reach areas. The big relief organizations, the International Rescue Committee, the Norwegian Refugee Council, they continue to have staff on the ground where needed, but are also feeling the strain and sending some home. NGOs are at the same time pushing the UN to keep international humanitarian corridors open in places like northern Syria. So, it's as you would have expected. It is complex. There are significant obstacles right now. There is some on the ground presence. There would be a more considerable on the ground presence of internationals in cases where they are using local staff, and that's so it's really that's kind of the best thumbnail or snapshot I can provide on that issue.
And before we go to the questions, I have one more that I want to ask you, and that concerns you mentioned that we expect things to get worse in a few months. And you've been involved throughout your career in some very serious refugee and humanitarian concerns, as well as living in the midst of this now in a very influential role. I know you signed on your organization to the 14 points that has been circulated. It's one of the things that I have listed for people that want to go deeper to read. What would be the top things you recommend be on the table for policymakers as we enter in into the months ahead.
Yeah. Well, let me just restate, Ruth, what I see as the particular challenge in this case. This is certainly a unique experience for a humanitarian from the global north, like myself, because it is the first example I can think of where our capacity, where the capacity of countries in the global north to respond effectively to significant and substantial challenges in the global south is impacted by our own perception of how this crisis is hitting us, right? I mean, I was trying to think of another example where we have been so emotionally and psychologically constrained to exercise our common humanity as we have been in this instance. Even in the 9/11 crisis, that was seen worldwide, I think correctly, as a crisis involving, in large measure, not exclusively, but in large measure, the United States, but not really a crisis that had a direct impact on the global south. And so I think the first imperative for me is just to the importance of sounding the alarm and being a voice, to use a hackneyed phrase, a voice for the voiceless. You know, you look at the U.S. COVID response, the legislative response to COVID-19. It was huge. It has been huge by any dimension, estimated at about $3 trillion. $3 trillion. Out of that total, you'd think, well, understanding that the overwhelming majority of that support needs to be devoted to the crisis at home, right? I mean, governments have a responsibility to their own citizens first and foremost. Nobody would quibble with that imperative. But you'd expect in a $3 trillion supplemental, you might have 5% for a global humanitarian response, 2% for the global humanitarian response. No, but in fact, the percentage of funds that could be linked directly to the global humanitarian response was about 0.03% of that $3 trillion. And I think that is indicative of the challenge that I think we confront, that rich governments confront. And I think that is why I think it's incumbent. That's why I think an organization like ours, Refugees International, has a critical role to play, because what we do is advocacy. And I think we take the responsibility of bringing this need to the attention of policymakers very, very seriously. And the reason is not only is it in our moral interest, but it also is in our very practical interest, because this is indeed a global pandemic. And anywhere we are not addressing it, it creates the potential for very serious threats for all of us.
Thank you, Eric. And I invite, I'm going to start looking at chat to see if any of you have questions that you want to raise. So feel free to send a chat question to me, Ruth Wasem, on the screen, and I will raise it for discussion. I've been struck too. One of the things, and we've talked about the plight of refugees and COVID, but there's also been some wonderful stories of refugees who are essential workers, who are medical professionals, who are working and doing all of the important things that are keeping things going. Do you have any, Eric, that come to mind?
Sure. I I think this is happening worldwide, but I think we've also in our offices been looking at and cognizant of the way in which refugees have been subjected to what I would call evidence-free. Nobody should be subjected to vilification, but evidence-free vilification is even worse than vilification by itself, I guess. And so we've been looking at examples and cases of refugees who are playing important roles in efforts to fight the pandemic. And I'll sort of talk about a few examples that come out of our own interviews from Refugees International. A Dr. Kelly in Georgia, he's a Syrian refugee doctor who has been widely interviewed in the media. He's been giving advice to refugee families on social distancing during the COVID-19 emergency. Both he and his wife are doctors. They've been working on the front lines. In New York, Russia, Abdallah, a doctor who has been trying to practice medicine in the United States for several years, waiting to hear from New York State if she will be accepted to practice. She is working as a volunteer due to the new executive order because she has an EMT license and is hoping to volunteer in that capacity. We have a story of in Pennsylvania of an ICU nurse, Saimu Sakur, who has been serving on the front lines of the COVID-19 emergency. In Michigan, Jihan Daman runs a maternal health clinic in Michigan, and right now she's helping educate mothers and babies about COVID-19 precautions through her health programming, and on and on and on. All of the evidence, all of the research, has demonstrated that refugees, by and large, with very little to start with, resettled refugees acclimate very, very successfully into the United States and play a very productive role in our society, not only as economic contributors, but as contributors who can draw on their own very challenging experiences in playing a role in contributing to the social and economic health of our society. And so none of these stories really should be surprising to anybody.
Yeah, I realize I err, like many people do, just in my presentation of when doing the photos I selected, of course, are photos of people in crisis. They're refugees and forced migrants, pictures taken at the most compelling and gripping moments in their lives, not revealing the completeness of who they are and the human capital that many of them have. And so I realize that it's easy to forget that refugees are often people of considerable accomplishment, as well as people who have survived quite hardship, quite a few hardships.
Should I make my point, or
yes, go ahead.
Well, I mean, everything you're saying is true. And the other point to be made, again, for a group of people maybe who are not very familiar with the U.S. Refugee Resettlement Program, that program is hardly a gold-plated social assistance program, anything but. The model that the United States has used over the years, in comparison, in juxtaposition to the models, say, for example, that have been in use in Germany, is we've adopted a self-sufficiency model for incoming refugees. When I became Assistant Secretary of State in 2009, I traveled to I traveled to Arizona, Minnesota, Florida, Illinois, Indiana, and I don't know where else to meet with resettled refugee communities. And I was struck at the time, for the first couple of few months after people's arrival, we give agencies and the refugees a grant to kind of get on their feet. So for that period, we were giving them $900, and my attitude was, I completely understand the need to have people come up from their bootstraps, if that's the expression, but we shouldn't force people to decide after they arrive whether they should buy diapers for their children or food for their children. And so at the time, we doubled that grant to all of $1,800 a month, split between the agency that was resettling them and the refugee themselves, the refugee himself or herself. And that's it. That was basically for the first many weeks after arrival, that's it. Plus, obviously, engagement from the resettlement organization, and limited access thereafter to some state-based benefits. But the refugees who come in here do not come into a gold-plated program by any means. And I think that's something that many Americans just don't fully understand, and nor should they have any reason to understand, because not all of us are follow this program very, very carefully. I'm sorry, you said there was a question?
To this end, one of the questions that has come in has to do with whether or not we have been providing translations, information on COVID in a variety of different languages. And do you know whether your organization and others have materials out there so that the word is getting out on a regular basis to this population? Or these populations?
It's a great question. It's a great question. I don't know the answer to it. I mean, I much of what I've been talking about here has been, is connected to the work of one of our senior advocates at Refugees International. Her name is Yael Shaker. She's an immigration historian who is our advocate for U.S. domestic resettlement, and I can take that question back to her and see what she says. But I don't have I can tell you what I would surmise, but I don't have a good answer to that question.
One of the other questions you talk about when you were in the State Department as an assistant secretary for refugees, population, and migration, how you traveled around the United States, and one of the questions has asked about since the state and local governments have been taking more of a leadership role and a day-to-day role in the COVID response, does that parallel what they're doing in terms of refugees? And I think I know the answer, but I want to give you a crack at it too, about the role state and local governments are doing with refugee resettlement.
Yeah, I mean, Ruth can talk also in greater detail probably than I can about the system. It's sort of a joint, it's a partnership between the federal government and the states. And after refugees are admitted and decisions are made at the federal level in consultation with the states about where refugees are going to be placed, then much of the support or assistance to refugees comes through state governments and through the vehicle of the state refugee coordinator, and also with federal support, but it becomes more of a state responsibility. But rather than talk about that issue with respect to refugees, and we can because it's also become politicized since 2015, the issue of refugee resettlement in the United States was always a bipartisan issue. Even I would say, go so far as to say a nonpartisan issue. Between the Refugee Act was was enacted in 1980. That's when we started this formal resettlement program, although there was refugee resettlement even before the Refugee Act. But between 1980 and 2015, there were some expressions of concern about refugee resettlement, but it reflected a strong bipartisan consensus. In the last year of the Bush administration, I would venture I won't say guess because it's more than a guess, I would venture to estimate that the George W. Bush administration probably admitted about 14,000 Iraqi refugees. You can check that number, but I think it's in that neighborhood. So there was no, and this was after 9/11, right? Yeah. So this was after 9/11, after the program, was built back up. But after 2015, the issue became more polarized politically, in my view, tragically so. And we can talk about that, and Ruth can talk about that. But I'm going to make a different point. And I don't know if this was the point you were going to make, Ruth. But on migration issues, on integration issues, on issues of inclusion, what we find repeatedly is, in many cases, the people and the officials who are closest to the populations of concern are the ones who have the policies that are most sympathetic to the notion of inclusion and the need for communities to work together. And I think this is played out in the discussion about local and law enforcement and their relationship to undocumented immigrants. Like the concern that local law enforcement have that if every encounter with a law enforcement official and someone who is undocumented, takes place in the context of fear of that on the part of that undocumented person that they may be deported, then you're not going to have the kind of cooperation between law enforcement and the entire community. And that sort of much more practical, non-ideological, non-polarized perspective, I think you see that in many cases at the local level, where you have officials who are actually responsible for getting things done. And that to me has been very encouraging. And it's actually a little bit at cross purposes with this notion of some states being anti-refugee and other states being pro-refugee, depending on the political party of the state's governor.
Well, I can say that here in Texas, for several years, the state of Texas has not participated in the refugee resettlement program, was one of the first not to. Most recently, when President Trump gave the option of not participating in the formally participating, Texas was the only state to say, we're out. And yet, cities throughout Texas have been expanding their immigrant affairs offices, their immigrant incorporation offices, their welcoming communities. So at the same time, at the state level, there's a shutdown. You have a fostering, as you say, of support at least in cities, and I know in research of Abigail Fisher Williamson's work, she found that it was bipartisan. There were Republican mayors and councils that were also engaged in mid-sized cities around the country in immigrant incorporation efforts and bringing refugees in, because it's not uncommon for refugees to fuel the recovery because of their they come with a lot of a strong survivor drive. So that's kind of my answer to that question. I also wanted to give you a chance. I know we're starting to get towards the end of our hour, but Refugees International just came out with a brand new report. I believe it was yesterday, about this hemisphere, about a topic that is of great concern. I know with my students here at the LBJ school and people I know in the broader community. Would you like to tell us a little bit about what your new report has found?
I hope you're talking about the joint report we issued with Human Rights Watch on
Yes,
the
yes,
asylum, the so-called
yes,
asylum cooperation agreement with Guatemala.
yes.
Yeah, it'll take a minute or two to talk about it because I think uh, it requires a little bit of background. But the bottom line is, that we have this principle of in both international refugee and domestic law that if somebody's in fear of persecution and they show up at your border or they show up in your country, they have a right to make their claim. And if they are deemed to have a well-founded fear of persecution, you don't return them, right? And that's a legal obligation, but it's kind of intuitive too, right? I mean, it sort of makes sense. If somebody runs onto your property and says, if I leave your property, I'm going to get killed. You figure out some way to accommodate that and not return that person to a place where they would be at risk of persecution, and their life or their freedom might be in danger. So that's the principle, right? Now, governments of the world and the UN recognizes this, have developed what they call safe third country agreements, which means that if somebody from fleeing Eritrea transits Canada, goes through Canada and applies for asylum in the United States, U.S. officials can say, if they have especially if they have an agreement with the government of Canada, we appreciate your fear. We're not going to send you back to Eritrea, but we will send you back to Canada, where your case will be considered, and the Canadians can give you status. That's reasonable. It's called the Safe Third Country Agreement. There's a provision in U.S. law for it. The Trump administration, but there's an assumption under the Safe Third Country Agreement, right? You wouldn't say to someone who's fleeing Eritrea, okay, we know we can't send you back to Eritrea, but instead we're going to send you to North Korea, right? You wouldn't say that to that person, right? Because North Korea is not a safe third country, right? You wouldn't, and of course that's a silly example, but you kind of get what I'm saying, right? So you don't say to someone who's applying for asylum in your country, if they transited a hellhole, a place where they would not be safe, you don't say we're going to send you back there, right? But in fact, the Trump administration is negotiating these safe third country agreements with countries that are not safe to send people back to, with Honduras, with Guatemala. So in this fanciful example, you could, in theory or conceptually, you could have a Guatemalan come to your border, and if you have a safe third country agreement with Honduras, you can say, well, we're not going to give you asylum in the United States because we have an agreement with Honduras. We're going to send you to Honduras, right? And intuitively, generally, my view about the law, especially human rights law, international law, if intuitively it doesn't make any sense, then probably if you're using the law to defend your action, it's not a fair use of the law. And so we basically wrote a report about an agreement that the United States had reached with Guatemala. That Guatemala would receive asylum seekers essentially from Honduras and El Salvador. And if those people showed up at the US border, we would send them to Guatemala, where they could have their asylum claim considered. And if it was considered, they could live the rest of their lives in Guatemala. There are only two problems with that. Number one, Guatemala isn't safe for returnees. And number two, because Guatemala is not safe for returnees, this asylum cooperation agreement is essentially a means to promote forced return to their countries of origin. A Honduran who is returned to Guatemala essentially has no option to stay in Guatemala. So he or she is essentially forced to go back to Honduras because he or she has no choice. So that's what this report was about. The fact that 98% of the people who are forced back to Guatemala choose to abandon their claims and just take their risks and go back to Honduras or El Salvador. And if I were a Honduran or an El Salvadoran, you know, I would make that same choice. I'd be among the 98%, no matter how much fear I felt in Honduras. So that's what the report was about. And we were very happy, not happy about the policy, but we were very pleased with the report. It was a great collaboration with Human Rights Watch, where I cut my professional teeth, and where I started my career actually. So it was a very good collaboration, and I hope I explained it clearly enough.
Well, I think you did an excellent job, and it is a complicated issue. And when you add the overlay that now there's a concern that we are also sending COVID to our neighboring countries when we return people, when we deport people, that makes some of these policies even more suspect in terms of, or certainly not evidence-based. There was, I wonder if we can, oh, it doesn't look like it's almost 1 o'clock here on Austin time. So I don't think I can squeeze in my last question. I might try to catch something later, but I want to thank you, Eric, very much for joining us today. I know you're extremely busy, and so the fact that you took this time to educate us and go deep into one of the two toughest issues that face the world today, I really appreciate it. I want to thank those of you that have joined our discussion, and we will have the video up on the LBJ website by Friday, along with some additional reading material. And we at the LBJ School look forward to seeing you next week, May 27th, where our In the Arena discussion will be food insecurity in the domestic and international COVID context. And that's going to feature professors Aaron Lentz, Raj Patel, and Kate Weaver. So I thank all of you, and particularly Eric Schwartz, for joining us today. Bye from Austin, Texas.
Thank you.
So Laura, is there anything left to do? Or may I bid you a goodbye?
That's all, Ruth. Thank you so much.
Bye-bye.
Bye.